gave us, Steph?
Yeah, this is just the one before it. I just thought I'd show you.
Okay.
Choriotic villi sampling is called CVS. It's the newest kid on the block as far as it's much more finite than ultrasound, and it's not as it's not as invasive as amniocentesis. Amniocentesis, they put a needle right through your abdomen and they draw out the amniotic fluid. With CVS, they go in through the vaginal opening and scrape a little bit of the outer cord, chorionic.
Smart.
And so it doesn't disturb the fetus as much as when they put a needle through your stomach. So here you go. Here's ultrasound and the scanner and yeah.
Oh my God, I don't like that needle in there.
Yeah, it's pretty. So here we go. So here's amniocentesis. Here's the ultrasound scanner. Here's the vaginal CVS.
While they have an ultrasound, or while they're doing the ultrasound?
Yes.
Okay.
Yes. Because they have to see where the baby is
Right.
before they stick the needle in. Here's conception. Okay, so we're gonna actually start here. Do you have this one? No. I started the next one. So once again, here are the ovaries with the eggs. Here's ovulation happening. So once again, they're just kind of floating in this. These are the little kind of fibers, and the egg kind of floats up into the fallopian tubes. And as the egg is moving along the fallopian tube, this is where sometimes they have a tubal pregnancy because it gets stuck here and it tries to embed in this wall. It needs to get all the way to the uterus where the blood-rich lining is in order for it to actually implant and to grow and develop. Sometimes what happens when people have there's a problem with where the baby is lying, it's because it implanted way down here. And so what happens is the placenta is in the way of the baby coming out. And so sometimes there's bleeding and there's other things that happen if the placenta is in the wrong place or the placenta comes off too early. So think about it, if the placenta was way down here and you're trying to get this baby's head out, that's why sometimes babies were dying at birth, is because the baby was pushing against their own survival system. And also with the cord wrapped around its neck. So where the placenta lies is one of the things they look for in ultrasound. They want to know that it's up higher along the lining of the siding of the walls, so that when the baby starts to develop, there's room without having it to be an issue. Here's the actual cervix. It's halfway up right at the end of the, and this is what happens during labor. It's not what has to, it's a muscle. And the only thing you ever use it for is to have a baby.
So when you have a pap smear and the doctor checks, he says your cervix, oh, they look perfect.
Yeah, they go all the
and
way
then
up
he
to there.
pushes on your tummy.
Yeah.
While he's in there, he pushes on your tummy.
Yeah,
So
yeah.
your ovaries are like kind of near your actual hips.
Because they want to make sure it's not, they sometimes call that, sometimes if you have a tilted uterus, they can feel that when they're doing the pap smear.
Oh, wow.
Because if it's tilted, either it could mean that it's tough to get pregnant because it's tilted the wrong way, or that when you're giving birth, it could cause problems.
Oh.
So, yeah. So, on the very first day, hours after conception, it's called a zygote. By the fourth day, it's called a blastocyst because different things are happening. And by the time it gets to be, implantation happens at the end of the first week. So in the first 7 days after you conceive, tons and tons of stuff has happened. Tons and tons. Interesting enough, most women don't even know they're pregnant for 4 to 6 weeks after they actually are pregnant.
I know, it was like 12 weeks.
Yeah, it's very, because lots of women have a bit of spotting, or they think there's a period, they forget that they even didn't have a period. And interesting enough, there's all sorts of things that are happening in this period that have to happen for everything to go just well. So there's actually 3, they call them, when you go to the doctor, he talks about your trimesters. That's different than fetal development, because fetal development looks at what's happening, whereas trimesters breaks your 9 months into 3 distinct 3-month periods. That's not the way it is looking at prenatal development. In the first 2 weeks, lots of zygotes aren't feasible, and you will just have a very large period and you will abort. So many pregnancies never get past being a zygote. Then after it is implanted, and 6 weeks, it's called an embryo. And this is the whole debate about when does life start.
Right.
Is it in the first couple of weeks when it's just a developing zygote that's multiplying and dividing? Or is it when it begins to, the heart begins to beat at roughly 6 weeks after the fertilization happens?
So when now are they saying it's illegal to abort a child?
Well, you can get an abortion up to 20 weeks in utero.
Up to 20 weeks?
20 weeks, depending on where you go. But anything after 12 weeks gets a bit dicey, which is why amniocentesis isn't always the best thing to do, because they can't do amniocentesis till you're about 6 to 8 weeks, because there has to be enough fluid for them to put a needle in there to draw some out. And then by the time they get the information back, you're past your 12 weeks. So if you were going to choose to abort the baby,
Right.
it's actually past the time that it's safe to do so. Up to 20 weeks is also the age of viability. We're in a place now where we can keep the fetus alive and we can still abort a fetus is exactly the same place.
Wow.
Yeah, interesting. So, once again, interesting enough, in the first 6 weeks, you're not even sure you're pregnant yet. That heart is already beating. We've got arms and leg buds. We've got muscles being developed. It's an amazing to think about. In 6 weeks, 42 days, we have something that could be, become another human being. And once again, 30 weeks is about an average pregnancy. Average. So the longest period prenatally is the period of the fetus. The shortest period is the period of the zygote. Usually if there's going to be a spontaneous abortion, where it means the fetus is not viable, it will happen within the first 6 to 12 weeks after you conceive. The body will just try to get rid of it. It kind of takes care of itself. Here we go. Here's actually conception happening, where the sperm is entering, and once a sperm head enters the egg, look how big the egg is compared to the sperm. Yeah, huge, eh? Yeah. There comes a chemical all the way around the egg that makes it impermeable. Nothing else will get in.
Once the one is in there?
Once the one breaks,
creates...
when one breaks through the egg, there's a whole outer shell of chemicals that happen, and the egg is now impermeable to anything else. Wow. It's truly a fascinating process. Look at the 7th day. So here's all the DNA and the chromosomes and the cells and the genes all just dispersing all over the place.
Looks like a dust mite.
It
does.
It does. Yeah. Crazy, eh?
Yeah.
So this is the period of the zygote, 2 weeks.
Wow.
So by the time the fetus is now ready to implant, it has to have ways for it to be fed and looked after. So the lining of the uterus becomes its kind of place where it implants. Then what feeds it, it begins to grow the placenta. And that's the direct line between the fetus and the mom.